Is it normal or possible to have an increase in bloating symptoms at the beginning of taking the GI1 powder? Yes, absolutely. And I'll tell you why. Because at the lower doses and initially, it is acting as a prebiotic. So here's a study I found against Aspergillus, Candida, E. coli, Pseudomonas, Staphylococcus aureus, and Salmonella. And what they did was they used a 1-to-1, a 50% dilution of the GI1 powder against these organisms, and then tracked their growth or decrease in growth over 30 days. And what happened initially is in the first 48 hours, the level of Aspergillus went up, the level of Candida went up, the level of E. coli stayed the same, the level of Pseudomonas went up, Staph aureus actually went down, Salmonella went up. So, and remember, these are exponential. So when you're looking at these numbers, don't just look at the first number, look at the 10 to the number, 10 to the power of, right? Because that makes it an exponential increase or decrease. So you got to pay attention to that as well as the first number. So the reason that the gasiness and bloating is important is because if you have an excess experience with gas and bloating, that means that something is fermenting inside of you. You're not doing it. There's a microorganism that's eating your food and creating gas. So that we have to pinpoint what that is if we can and treat it. What's nice about the GI1 powder is that it takes care of both fungal, yeast, and bacterial species, so you don't really have to guess what you're trying to get rid of, if you even can. All right, so let's continue to track this as we go through time. After 3 days, some of the levels of the species start to go down, some don't. After 5 days, same thing. By the time we reach day 14, we're getting a decrease in all of the species, which continues to be tracked. When you get to 20 days, you can barely find any. You're looking now at less than 10 colony units that they were able to find after exposure to the GI1 for 20 days. And that just continues out until we get to day 30. So that's one of the reasons why I have people hold their high dose for 2 months, for 60 days, so that we can really get the numbers of those gas-producing species down, and then we titrate down to a maintenance dose, 2.5 to 5 grams a day, and that becomes now a prebiotic. So now you're using it as a prebiotic once you've adjusted the alpha diversity of your microbiome and gotten rid of the gas and bloating symptoms. So that's just how nice it works. Some people actually need to do longer than 60 days, and they'll usually consult with me or do something directly with my clinic so that we can get them on the right track. But any improvement that you're getting at the high doses after a few days is always just going to keep improving over time until you don't have that symptom anymore. You don't have to really worry anymore about gas and bloating, and diarrhea, constipation can also get better.